Hello, welcome everybody. Tonight I am going to be joined by Dr. Carole Gilling Smith from the Agora clinic in Brighton. She is the Medical Director, CEO and founder of the Agora clinic in Brighton, and we will be discussing patient care. What does patient care look like during this COVID era? How can clinics be supporting their patients at this time, and also what can be done virtually, and what do treatments look like as things change and clinics reopen. So hopefully she'll be here in a second. I'll be able to add her in. There we are. Welcome. Should be live in a second. Good evening. Hi, how are you? Can you hear me? I'm not sure whether everyone else can hear. Can everyone who's watching hear? I think it might be muted. Can you hear me? No. Okay. Those who are watching, can you hear us? If you could just drop a little comment. Yes, you can. Okay. I'm going to try adding again. Thanks to those who are joining. Bear with us, please. Let's try that again. Sometimes we don't have technology on our side, so please bear with us. Yes, thank you. So we're going to be talking about patient care tonight, and we're going to be talking about what can be done virtually, and also how the Agora are supporting their patients. She's just joining in a second, so bear with us. What they've been doing, they have the most fantastic support network and Facebook group, which I'll talk a bit about, or she'll talk a lot about, as well as how they're supporting the LGBTQ community and cancer patients. We'll also be speaking, oh, here we go. Right, let's see, we're just waiting. Let me just cancel that and re-add. Bear with us. Thank you everyone for your patience. Hopefully this one will work. Take two. There we go, it's just connecting. Hello, good evening.
Hello there. I'm sorry about the sound earlier.
Don't worry, we have you now, so that's perfect. I've just been giving those who are joining a little summary about what we're going to be talking about tonight. So if you could please introduce yourself, and then we'll start.
Okay, so I'm Carole Gilling Smith. I'm a consultant, gynecologist and a fertility expert, and I am the CEO and founder of the Agora clinic, which is based in Brighton, or Hove actually, as we say, but it's something I wanted to do and I set up 13 years ago. Wow. And before that I was a fertility consultant in London at Chelsea and Westminster Hospital.
Okay, great, thank you. I've just been explaining that we're going to start by talking a little bit about what you've been doing virtually, and most importantly, how you've been supporting your patients during this really difficult time. So if you could elaborate on that, and then we'll talk about this fantastic Facebook group that you have set up for your patients, that would be wonderful.
Yeah, I mean, I think we can all see the tremendous impact that the human touch has on patients who are suffering, because all the pictures we've been seeing about COVID patients, you know, and they're in hospital, and what's so important is that nursing care, that amazing support, all the journey that they're taking. And I think we know that that's exactly what our fertility patients need. They're frightened, they've got lots of questions, they need to be able to access medical expertise, not just in the consultation point. So we've always had that at the Agora, and I felt immediately that this situation happened, that this was actually quite frightening for patients. They didn't know what was going to happen to their treatment plans, and so from the moment that happened, we felt, okay, we've got to communicate. Once we started to see the face-to-face sort of being not banned, but you know, with social distancing, we couldn't do as much. We immediately sort of switched to online. So the first thing was that consultations can be very easily carried out like this. We can see it, you know, you're like in the same room as somebody. Then, you know, I started to feel we needed to just talk to patients, pick up the phone, say, how are you? You know, you've had your treatment stopped. How's the last week been? So we made sure we had a list of patients that we were not just sending a bland email out to. It was that human touch, being able to say, you know, how are you, Sarah? Or how are you, so-and-so? To be able to communicate every 1 or 2 weeks, to see how they were coping with the weights, with the, you know, with social distancing. And so all these things were really important. Then we always had a closed Facebook group. We called it Agora Friends, and we had it because we felt that patients share things. And it's fine having large communities sharing across lots of different parts of the UK or abroad in the UK. But what was nice about the community of the Agora is they were experiencing the same place to have their treatment, and they knew us and they knew the staff, and so they could kind of talk to each other. And then we have a few staff that join into that platform. And until the COVID-19 sort of lockdown, I didn't join it. I felt, have a little bit of space from the consultants, but I started to go in and give weekly updates and give weekly Q&As. And the patients, I think, responded really well to that. And video messaging. I was really trying to let them know that I was there for them. And I think it was really important they knew that, from the top of the clinic down, there were people there that they could access. And then we diverged to our patient support group, which had been physically on site at the clinic. We said, okay, let's start doing this through Zoom. And that really, and we linked in with all the patients, particularly all the patients who had joined Agora Friends. We linked them in and said, look, would you like to try this? And it was a phenomenal success. We found that more patients were comfortable. In fact, it was better than asking them back to the clinic, because they sort of associated the clinic as a not so good memory, whereas actually being able to get the support without physically going back into the clinic and do it perhaps with their partners was really, really good.
And also to be talking with people who are experiencing exactly the same as them, knowing they're not alone in their feelings and disappointment.
Yes, and you know what, the thing about the virtual environment is it allows you to be private and hidden, or you can be visible. And we use Zoom, but there are other ways of doing it, but we use Zoom. And if you want to stay hidden, you can. But if you want to be actually, look, here I am, you have your name and your video showing, and people do it different ways. In fact, we found most people did just want to be seen and talk. And it was almost like coming physically to the clinic was not comfortable. This is really comfortable. And we've also got a wonderful holistic therapist, Alex Olds, who normally does sort of face-to-face fertility massage. And she said, well, what can I do? So she's been offering the whole virtual thing with patients through Zoom, completely free. Patients, and what she's doing, and she's teaching the partner to massage.
Wow.
It's amazing bonding that the partner can actually help with the massage, the tummy massage. She's looking at diet, she's looking at meditation. So she's trying to give them this support, again in a virtual way. And I've even had acupuncturists who are doing virtual acupuncture. They're giving patients an idea of how to, where to put the pressure points in. So I think that virtual patient support actually is going to really take off and perhaps be better than some of the physical things that we were doing.
And I think you're right. Well, you are right. That personal connection is so important, because there have been lots of readers voicing an opinion that they feel like their clinics may have not been in touch, or they haven't really heard very much from them. And I guess at such a difficult time normally as it is going through treatment, to have the added uncertainty of when this might get better, which we still obviously don't know, and things aren't as clear as people may like after last night's speech, there's still this kind of cloud of uncertainty. And so what you really want is that personal touch that the Agora is giving people to say, we're thinking of you, you're very important to us, your journey is important to us, and we're offering these other options, or not other options, holistic things that you can be doing from home to support you whilst we can't physically be doing the actual treatments.
Yes, what I found was really helpful with the live Q&A I was doing on the closed Facebook group is actually the patients were giving me ideas. So as I was responding, I thought, well, that's a good idea. And so we got the idea of lobbying our MPs, and and now, for example, we think that we know that we're going to be able to restart treatment soon, waiting for the HFEA approval. But one of the things that we want is for patients to be allowed to have as long as it takes for them to come through for treatment away from the high-risk workplace, so that they can continue to shield, to self-isolate. So that's, they said, well, could you write a letter for my employer? Yes, of course. that came from the queue and the question, and I thought, yes, fantastic. And I said, yes, we'll do it. So I think we feed off each other, and this wouldn't come out necessarily in the consultation. So I think it's a really good platform.
Yes, yes, absolutely. So leading on from that, what is the latest from the HFEA? Because obviously the 11th of May was kind of the next step or the date given. Has there been any update today?
Yes, so the steps are I mean, I posted a video on our social media, and I posted on our website over the weekend to explain the steps. So we have spent the last week finalizing, because we've done already a lot of work, finalizing a plan to make treatment absolutely safe for any patient returning for treatment, or any patient starting on treatment, and for all the staff coming back to work. And we've covered absolutely every aspect that you could think of. And the HFEA, I wrote to my inspector this morning, and they sent me the questionnaire. This is a 50-question self-assessment questionnaire where we answer and we reference the relevant policy we've put in place. So it covers everything, and it should reassure patients that the HFEA hasn't just said, okay guys, reopen, it's fine. They have ensured that every single licensed clinic in the UK has gone through the same process. We're all doing it. We are making sure that I described it on my website video. If you go there, I've described it as literally, I have taken the patient journey from the moment they phone up and call the clinic to the point they leave us after their pregnancy scan, because that, all those interactions we've risk assessed, because this virus is deadly. It can be deadly, and we do not want anybody, staff or patient, to be infected as a result of us opening again. So that's what the HFEA want to. So the next step is that we respond with the returned questionnaire. They assess it. They've said up to 5 working days to give you a response. And once the response is given as, yes, we're happy, we're satisfied, you've put in all the right measures, you can restart. And at that point, we can contact all our patients who are on a very, very careful, detailed list to give them the next instructions. Okay, you're ready to start on this point, or you're ready to start a bit later. So, I mean, that's the next steps. Now, patients are saying, well, where am I on that list? Am I going first?
Yeah.
And I think each clinic will have its own system, but what we've done at the Agora has been around trying to be absolutely fair and absolutely transparent. So in date order, when treatments were cancelled, February, March, April, patients are coming through largely in date order. But when it comes to a patient with a high priority, patient with cancer, I mean, we're seeing patients with cancer who need to freeze eggs, or patients, they have to come up to the top of the list. They have to be treated immediately, and patients that are in an older age group. So really important to assess the ovarian reserve and the age of the woman, and make sure that no significant further delay, because we've already delayed some patients by over 2 months, and we don't want, we know that there is going to be a small decline in particularly in older patients, not so visible in a patient of 35, 36, but once you're getting 39, 40, 41, 42, those are the patients where every month counts. So there is an element of assessing the need, but every clinic is going to have their own system, and every clinic is going to have to assess how much capacity they have to see patients and how quickly they can bring them through to deal with a backlog. And that's going to develop. Do they have enough staff? Are some of their staff still deployed in the NHS? And those are questions that every clinic's had to answer.
And what are the things that you're putting in place for the reopening in terms of safeguarding the patient and the staff?
Well, the first thing, we have a full staff. We've been able to retain all of our staff, and so we go back in with all the staff we had. Nobody's got any particular issues that means they can't come into work. We are really from the point, so let's take the journey from the point of the patient coming to the clinic. They will be asked to wear face masks and make their own as well. We've made that a little project. We've said, look, these are instructions. It's actually try to make this as part of your fertility journey. You can put it in your memento box at the end of it.
Exactly.
Make something that kind of makes you feel good, that this is going to be something you bring, and only use it for your appointments and your clinic visits. We have a perspex screen in front of the reception desk. Staff will be wearing personal protective equipment in terms of masks and you know, when taking blood, they'll be having gloves, they'll be having aprons, they'll be having goggles. You know, those are the sort of things that we have to follow, the you know, the guidelines around personal protective equipment for all the different stages, obviously going through to egg collection. We've got, you know, very few people in reception. We're going to continue with all of our Zoom consultations. I probably told you we do home fertility tests.
Oh yes, please go into that.
Yeah, so I'll tell you about that later, but we don't need them to come in physically. So really only patients that have an appointment for a monitoring test, scan, ultrasound scan for their treatment or their actual treatment itself will be coming in. Men will be required to bring their pot in, if you like, their sample in, but not unless they've got a reason to have to produce on site. We're keeping so the number of people coming into the clinic will be much less, you know, by a long way. And then the spacing of all the reception chairs, we've taken out half the reception chairs. There's not going to be. And patients are going to be asked to do a self-assessment questionnaire 2 weeks before they attend to make sure they're low risk, and if they're not, we're going to follow it up with COVID testing. So there's a lot of things like that we've put in. Staff has the same thing. They have to do a self-assessment questionnaire, so we know that everybody who's physically on site at the clinic is virtually zero risk of having COVID-19. And during the time of the lockdown, we've been doing pregnancy scanning, and we've been doing the cancer work. So we have been working to this policy. This is not a new policy for us, but it's just been refined to adapt to everything. And for patients, I mean, we've got to be really mindful of risk of complications. So any IVF patient, we've always been very careful about not, you know, giving patients a risk of ovarian hyperstimulation. So we are obviously maximizing that. We're using protocols to really reduce that risk. Those are kind of the bare bones of it all. There's a lot more written down in a detailed policy, but for the patient, they will not notice, I don't think, a huge difference apart from the personal protective equipment, because we know that, you know, this is a process that we can do quite safely without changing very much indeed. So you know, you're still going to get the same IVF treatment plan.
But to be honest, that personal protection in terms of masks, etc., it sounds like that's going to become quite commonplace in other areas such as public transport and things like that as well. So we may start to get used to that. We've had a couple of questions, if you wouldn't mind me asking. Someone has asked, how long is the backlog of patients you have at the Agora clinic?
Well, we would say, I think for initial consultation, there's no wait at all. We don't normally have a wait at all between consultation and going on to treatment, but because we stopped treatments probably around the 23rd of March was when we started to say to people, right, okay, this is the last set of patients coming through. We would say there's going to be about 2 months worth of work. So to really, you know, to be honest, that's a larger volume than we would normally want to do in a month. We don't want to squeeze that volume in a month because we want to make sure we don't have too many patients at the clinic at one time. We've just spread our work across 7 days. Now, we're not at one of these clinics that work 7 days. So actually that was great because we've got loads of room for expansion. So we can actually see quite a lot more patients than we would normally see in a typical month. So we'll be able to catch up quite quickly, and all the staff are really keen. So we're doing Saturday scans all day, which we don't normally do. Sunday treatments. So that will allow us to get those patients that have been waiting through a little bit quicker, not without losing the personal touch, because all we're doing is we're taking the appointments across the 7 days of the week, a longer day really, with more shift work, so less staff in the clinic at once, less patients in the clinic at once.
That's very reassuring to hear, and I'm sure that will be quite helpful for some people who are working from home anyway. So that's someone's asked, what's likely to happen if treatment is successful? Will patients be able to go back to work, or if they're newly pregnant, would there be a need to self-isolate?
No, at the moment there's no contraindication if you're pregnant to going back to work, and you know, we wouldn't be starting fertility treatment if we felt that COVID-19 was a contraindication to pregnancy. That's the first point. So what every employer has to do, just as we've done, is they've got to risk assess their workplace. They cannot allow their staff back into the workplace unless they've put in the appropriate measures. And that might be, perspex screening between all the desks. Each person has their own workstation, which is what we've done. Each person has their own workstation. We've now had to limit the number of people in each room so that there's 2 meter distance. So workplace should be safe. And there shouldn't be any need to feel that just because you're successful and you're pregnant, you can't go back to your normal life. But every employer is going to have to think about all sorts of measures. I think, Boris was alluding to this today, including how to get to and from work. And I think, the main risks are certain forms of public transport. Where I live in Brighton, we don't have the underground, which I think is quite a difficult one to control, but we have buses. We have obviously cycle lanes, we have the ability to walk, but I think everybody has to think very carefully about how they get to and from work. And we're also saying the same thing about the clinic. Think about, I had a conversation with somebody today. She doesn't drive and she lives a little bit too far away from the clinic to walk comfortably on the day of egg collection. I said, well, I think that's the day to either get somebody to take you in who does drive, or to get a taxi. Just think about those situations so you minimize your risks.
And stress as well.
Absolutely, yeah, absolutely. I think that what we want people to do is to feel, well, first of all, people have a choice. They don't have to come back and do treatment straight away. If they feel, actually, I'd rather wait a month or two till the figures get better, the pandemic's a little bit better, so that they always have an option. But I think most people are quite keen to get back onto their treatment plans, and I think they need to feel that with all the safety measures we've put in place, they've got a safe environment to come through, and they should feel that we're still going to be the same people, still giving them the same support.
Exactly, and the same care. I totally understand that. Thank you for explaining. I think it's actually one of your patients has said, I'm waiting for my nurse consultation for my second fresh round. When is that likely to be, please?
So the day that we get the okay from the HFEA, which I said will probably be at the end of this week or early next week, we have the list of all the patients for second nurse consultation, and that second nurse consultation is really about setting dates. Legally, no IVF clinic in this country can set dates at the moment. They cannot say to a person, you can start your medication on this date, because until they've been told by their inspector you can reopen, they can't do that. So if you are waiting for your second nurse consultation, one of our lovely nurses will be booking that in for you with a phone call next week probably, to give you your dates and make sure you know exactly when you're starting your medication. So don't panic. We know you're there. We really do. And if you received a phone call from us over the last few weeks, we know you're there.
Perfect. Thank you so much. Someone's asked actually about offering new patients appointment slots as soon as the HFEA approves reopening, but you sort of covered that already, saying that you're doing that already virtually. Yes,
we've been seeing lots of new patients. So one of the things that we've been able to do at the Agora is do fertility investigations from the safety of your home. We've got something on the website about it. It was on BBC Southeast News. We've got home sperm testing, and we've got home ovarian reserve testing. It's a finger prick test. So it's very safe. It's very easy to do. Our nurses will provide extra support over the phone if you need it. It really, what we do is we set up the home sperm test and the home finger prick test exactly in the same way as we did invite you in previously to do those tests, and we follow it up with the medical consultation. You have a questionnaire to fill out on if you're single or if you're both partners, same-sex couple, whatever, and then you have your doctor's consultation with Zoom about a week after you've done your test. It's very, very quick to get the results. The men get their sperm test result immediately on their phone. It's fabulous. Literally, it's a really good system. So we do all of the initial workup and preparation, and then when we feel that they know what they want to do, we can bring them in for a baseline pelvic ultrasound scan and any other tests they would need for treatment. So we wait until we've explained everything to the patient, and then we're in a position to start. So I think that will continue. I think for patients who don't particularly want to come in to the clinic to do these tests, that's going to continue.
Okay, great, thank you. A couple of people have just joined and they've been asking for me to reintroduce you. So this is Dr. Carole Gilling Smith from the Agora Clinic in Brighton in England. And we've just been covering what you're doing at the Agora to help with patient support and patient care virtually at the moment, and talking a bit about the procedures and the safeguards that will be put in place when you reopen, hopefully imminently. So someone has just asked, can blood tests be performed by finger press prick blood test from home, which you've just
I've just answered yes,
answered.
it can be. All of AMH, FSH, LH we do, and thyroid function we do from the finger prick test.
Great. And another question, sorry, whilst you're here, quicker procedures such as fertility preservation, fertility testing, will they have to wait due to other patients having more pressing complex needs?
No, I don't anticipate a long wait. I think we've got patients coming through for all different needs. And, you know, when patients come through and have a doctor's consultation, they don't start IVF the next day unless they're a cancer patient. They usually need time to sort out their own lives and to work out exactly when it will suit them. So, you know, for most patients I'm seeing at the moment, actually, you know, we're probably talking about, patients I'm seeing for new consultations now, we're probably talking about treatment in July or maybe August. It's not, you know, we're not talking about a 6-month wait. It's possibly a few weeks longer than previously.
Okay, that's really good to know. Joanne, I hope that answers your question. You've sort of asked the same thing. I believe you're a patient at the Agora and you're due to start soon, so hopefully that will answer that for you. The other thing that we were going to touch on, you've mentioned that you help cancer patients, and also I know that you help the LGBTQ community. So are you able to elaborate a bit more about that, please?
Yes, I mean, the Agora really treats everybody, whatever their needs. There's a kind of non-discriminatory policy. So I've been seeing patients who are transitioning, who need to preserve their fertility. I've been seeing same-sex couples. We've been doing virtual patient open evenings. So I have one which is for same-sex couples and single women who want to do solo motherhood with donor sperm. I have another one which is for heterosexual couples who have fertility needs. I kind of alternate them each week. They've been working really nicely. We're using Zoom, and it means that they get, you know, all the options, all the investigations that are needed, all the options for treatments explained to them, and then usually they follow it up, book a fertility MOT, and then come for their initial consultation. And we treat a lot of same-sex couples. 15% of our population in Brighton is from the LGBTQ plus community, so it's inevitable. It's part of our work. We kind of don't treat them as different. There's everybody's the same. At the Agora Friends, our Facebook group, everybody's a member that is a registered patient at the clinic, and in fact a lot of common questions from both straight couples, gay couples. It's they're all wanting a baby, and we have there's a lot of common ground there with the treatments.
And what I love about this community is that, as you mentioned, it covers so many people in so many different parts of the world, going through different treatments, different scenarios, and families being built in different ways. So it's wonderful to be able to offer all of those different options, and to support people in whatever their needs might be.
Yes, and I think what I've certainly seen over the last 10 years is a growth in particularly shared motherhood, and it's become possibly the most common option for patients, and some of those patients like to share their eggs, some not. So, you know, it's lovely for one partner to donate her eggs to the other partner who receives the embryo and carries the pregnancy. And that's working really nice. We also see gay men, and they embark on surrogacy, gestational surrogacy. So quite a diverse range of treatment options that we can do. Amazing.
Thank you. So we've also covered the HFEA sort of update. If anyone has any more questions, now is your time to send them over, please. If not, I think that we have covered everything. So thank you. And once again, it's good to hear about the support you've been offering your patients, and the fact that you're able to offer all of these virtual appointments and support whilst we're waiting for the doors to reopen. So thank you for explaining.
There's a question I can see about my IVF clinic is still shut. Now, what we have to remember is that some IVF clinics are sitting in NHS hospitals, and their facilities have therefore been taken over by the NHS during the COVID crisis, and the staff have been redeployed. So for the patients that are attached to that clinic, there may be a longer wait to restart. I can't be as optimistic as where we are at the Agora. I think it is worth ringing the clinic to find out whether they are transferring patients to other centres, or whether they've got an arrangement to allow patients the option of perhaps transferring. I think it's inevitable that it may take some clinics a little bit longer to restart. We are not in that situation, so that's why I can talk about, yeah, we can restart probably next week.
Okay, so people should really just stick close and make contact with their clinics to find out what the situation is.
Yeah,
great, thank you so much. Well, it was lovely to speak to you this evening. Thanks again for your time. Sorry, I think we've got a couple more coming in. They are NHS, yes, so that would be why, I presume. Thank you.
Yeah, and they're great clinics. To be honest, I feel sorry for the patients there, but I know that the staff are just as frustrated in those clinics. They just can't. It's beyond their control.
Absolutely. Thank you so much for your time. Thank you everyone for joining this evening. Lovely to speak to you.
Okay.
Thank you.
Thank you.
Bye-bye. Bye.
Bye.